Welcome everybody to the next session of the Hemposium. Thank you for coming out on this rainy day, and thank you very much to Professor Kylie O'Brien, who has travelled all the way from Victoria, from the chill out zone of Hepburn Springs to another chill out zone, I must say. And Kylie is very much an expert, has a long history in Chinese medicine, and has also been doing a lot of work now with medical cannabis in the last few years, including doing a lot of doctor education and also helping doctors really make their way through the Therapeutic Goods Administration sort of system and regulations to do with prescribing medical cannabis. And today you're going to speak about really a lot of research you've been doing into cannabis and mental health, and that also includes a very important issue of using cannabis therapy for end-of-life situations. So thank you again for travelling all this way. It's very exciting to have interstate visitors, by the way. It's like some kind of exotic creature. Okay, thank you very much, Kylie. He's on away. Thank you.
Thanks very much. I don't think I've ever been called an exotic creature, but there you go. Now, have we got the slides up? Can you see them without me? You can see me. Right, hang on. Okay, are we on now? Yay! Okay, fantastic. So I want to talk about mental health today. I've got a background in Chinese medicine, so I'm a Chinese herbalist. I'm not allowed to prescribe it because I'm not a Western medico, and that's the rules of this country at the moment, something I am actually trying to help change as well. So I'm interested in mental health for a number of reasons, but what I want to do in today's talk is basically guide you through what evidence in medicine can and sometimes can't do, because evidence in medicine is often used as a political tool. So it can do good and it can do evil. So I'm going to, if I said the word endocannabinoid system, put up your hand if you know what I'm talking about. Are you all experts on that? Who knows nothing about it? Absolutely nothing. Yeah, all right. And okay, so we'll start at that point, I think. Just some of my declarations here. And this is basically an overview. And I'm going to focus on mental health. So, people are using it. If we look into the research here, and this is where we can start to use the good stuff about research. An Australian study done by a colleague of mine, Nick Linciris, back just after it became legalised as a medical use in Australia in 2016. They surveyed users and said, well, what are you using it for? And guess what the top reasons were? Anxiety, you can see there, depression, sleep problems, and PTSD was in there as well. And you'll notice that more than 80% said it managed their target symptom quite well. Now, similar time period, Washington State University also did a survey. And guess what? Same sort of thing here. Pain was their top one, and it also is commonly used in Australia for that reason too. And anxiety and depression there as well. And again, we see that almost 60% used it as an alternative to pharmaceutical prescriptions. And that probably makes a few companies feel a bit nervous, I'd imagine. In cancer, it's commonly used by cancer patients. Again, this survey shows us, in this particular cross-sectional survey, and these surveys give you a snapshot in time. Overall, 75% were using them for the physical reasons. That would be, physical pain and nausea and vomiting and things like that. But 63% used it for psychological purposes. And cannabis was most usually used frequently for pain, then nausea, then the stress associated with having the disease. Now, PTSD, cross-sectional studies show that there are high rates of non-medical and medical use of cannabis to manage the symptoms of PTSD. And these are sleep problems and nightmares, re-experiencing hyperarousal symptoms, or avoiding situations so it doesn't trigger an attack. They did a study in New Mexico, and they found that patients who used medical cannabis reported reductions of 75% in trauma-related symptoms. So you can see that they're getting some good results. There was another one done in Canada. Now, this was a big survey, but out of those thousands of people who responded to the survey, 420 of those were patients with PTSD. Now, out of that, almost 30% had reported past year cannabis use, compared to only 11% of those without PTSD. Now, interestingly enough, in the cannabis users, PTSD was not significantly associated with either major depressive disorder or suicide ideation, but in the non-cannabis users, PTSD was significantly associated with a recent major depressive disorder or suicide ideation. So this gives us some evidence that suggests perhaps cannabis use might contribute to actually reducing the association between PTSD, suicide ideation and severe depressive episodes. So, for those who don't know anything about the endocannabinoid system, I think this is a really good place to start, because when people start to bang on about cannabis and phyto-cannabinoids and things in cannabis being dangerous, etc., which they're not, what's interesting to say is, do you know that you actually make your own cannabinoids in your own body? These are called endo. Endo means within the body cannabinoids. So what is our endocannabinoid system? It's probably one of the most, if not the most important neuroregulatory system. Neuro just means nerves, regulatory system in our body. So it's a major modulator of the connections between our nerves in our body. It's got wide-ranging effects on many parts of the body, and we'll look at those in a moment. So here are some of the parts of us that the endocannabinoid system modulates. So it's our stress response and our emotions, our memory and relief from dwelling on fear, which is of course important in PTSD. Sleep is regulated by the endocannabinoid system, including our circadian rhythms. Our immune system, our ability to fight off diseases, is modulated here by the endocannabinoid system. As well as our nerves are protected, our neural plasticity, so our growth of our connections in our brain, which continues throughout life, and many others. Our gastrointestinal tract, our appetite, etc. So you can see that if we didn't have an endocannabinoid system, we wouldn't actually be here. Now, it's got three main components. It's actually got a lot more than that, but we'll keep it basic. It's got receptors. These are called cannabinoid receptor 1 and 2, and I'll show you where those are in a minute. We've got our endocannabinoids. We make these. Anandamide is one of them, so AEA is just short for anandamide. Ananda means bliss in Hindi, so anandamide. And 2-arachidonylglycerol, 2-AG. And then we've got enzymes that help create them and then break them down when the body's finished using them. So our body is an intelligent system sometimes. So these are our endocannabinoids. They're synthesised from fat or lipid precursors on demand. They do have actually some reservoirs they've found in more recent time, but they bind with the cannabinoid receptors and they then affect their change that way, and then they get degraded. Whereas the phytocannabinoids, like THC and cannabidiol, they stay in the body longer. So this diagram just shows you a bit of where these CB1 receptors and CB2 receptors are located. CB1 receptors are in particular in our brain, our central nervous system and our spinal cord, but also in many other parts of the body. The CB2 receptors are particularly concentrated in the cells and the organs of the immune system, but they're also in other parts of the body as well, and they're also in the brain. So if we look into our heads now, we've got a high concentration of CB1 receptors in our brain, in those areas of the brain that are responsible for our thinking, our cognition, our motivation, also our emotions. So there are some key areas in the brain which I'll focus on in this talk. The prefrontal cortex, the front of your brain, the amygdala, and the hippocampus. Those three are called the corticolimbic system. But you've also got CB1 receptors in other cells within the brain. These are called astrocytes and microglia, and they tend to get ramped up when you get neuroinflammation, nerve inflammation in the brain, and that can be part of what happens in various mental health conditions. So CB1 receptors are there to maintain a delicate balance between excitation and inhibition of other neurotransmitters. Now, we even see them down to the level of the mitochondria. So within our cells, each cell's got different organelles inside them, and one of them is called the mitochondria. It's responsible for our cellular respiration, amongst other things. And when they've done animal studies of traumatic brain injury, they've actually found that these mitochondrial CB1 receptors get upregulated. They get ramped up, in other words, in the first 24 hours following a brain injury. So again, these things are happening within our body to help us get past injury and bring us back into balance. This is what homeostasis really is. It's keeping the body in balance. Now, these CB2 receptors, as I said, are particularly common in our immune system. And generally, they lead to protective mechanisms. So they help to reduce, in the most part, inflammation and tissue injury when they get activated. Now, if we look at what happens in the brain, and the reason I'm bringing that into it is that in various mental health conditions, you can get inflammation. And you can get those in other neurological conditions too. So we have less CB2 receptors than CB1 receptors in the brain. They are involved with these other cells called microglia and astrocytes, and under certain conditions, for example, in anxiety or where there's inflammation, the number of these gets ramped up. And it suggests that there is a close association between the expression of these CB2 receptors and various psychiatric diseases or disorders. So normally our microglia are in what they call a resting state, but when there's nerve inflammation, they get ramped up, they get activated, and they can start to spit out a whole lot of chemicals which don't do our brain any good. Now, at the same time, you get an upregulation of these CB2 receptors to basically protect our nerves. So they're trying to control the production of these other nerve toxic chemicals which could cause damage. These are called cytokines and other things. So the relevance of this is that there is neuroinflammation thought to be present in a number of different mental health conditions. So how does the endocannabinoid system actually work? Well, we have, under normal conditions, we've got low levels of the endocannabinoids. When we have a trigger for them, and that could be stress, it could be inflammation, even exercise, these get ramped up. We get more of them synthesised. And what they do is that they actually reduce the rate of firing of other transmission of other neurotransmitters. So they're called retrograde messengers. So the bit down the bottom, it's like you've got a receiving nerve and you've got a nerve and they want to communicate like that. Now, in the postsynaptic, the bit down the bottom, basically with that trigger, you get our endocannabinoids being synthesised, and you can see the one on the right-hand side, AEA, anandamide. It goes across that gap, if you like, that's called a synaptic cleft, and it binds with one of those receptors. And that binding of the receptor with that endocannabinoid then sends another message to another neurotransmitter and says, hey, slow down. And so it reduces the amount of neurotransmitter release. This is what happens in nerves. And then those endocannabinoids get rapidly degraded and out of the body. But it does have other mechanisms of action. For example, our immune cells all talk. They're all talking to each other all the time. And so the endocannabinoids can bind with the cannabinoid receptors, and they cooperate with other signalling molecules, and they modulate that crosstalk between the immune cells. Now, they can also regulate what we call tight junctions in the gut. Now, has anyone heard of leaky gut syndrome? Do you know what that means? Yep. Okay, so basically in our gut, we have a lot of bacteria. That's called our microbiome. So we've got about 2 kilograms of these bacteria in our body. We wouldn't be alive without them either. So bacteria are sometimes our friends. Now, the endocannabinoid system regulates the gut activity. And there is a relationship between our brain and our gut. It's called the Microbiome-Gut-Brain axis. So they're in constant communication, and they mediate, our stress response and our moods and emotions, as well as our immune system. So our gut is very important, which means look after your gut with good diet. So the gut microbiota can actually produce many of our neurotransmitters, or the things that happen before the neurotransmitters are produced. They're called precursors. Now, we know from research that depression is associated with dysregulation of the composition of those microbiota in your gut. They've also found with research that you get problems with intestinal permeability. So normally those cells in the gut lining it should be nice and tight together, but if they aren't, then you can get things from the gut going into the bloodstream that shouldn't be there, and they then start to cause inflammation. So they think that the gut and the endocannabinoid system and some mental health conditions might be linked via inflammation. And we know from research, which I'm going to talk to you about in a moment, that inflammation is involved in the pathogenesis or the pathomechanisms of several different mental health conditions like depression, anxiety, Alzheimer's disease and autism spectrum disorder. So we're going to have a look at the brain just briefly. As I said before, the corticolimbic system. We've got the amygdala, the prefrontal cortex and the hippocampus. And we know that the endocannabinoid system is very abundant in these areas of the brain. So we've got lots of cannabinoid receptors, and we've got the enzymes that make the and break down the endocannabinoids, and we've got the endocannabinoids there as well. We also know that the endocannabinoid system is involved in our stress response. So what happens when you step off the curb and you're about to be hit by a car? What does your body do? What do you do? Tell me. Sorry? Freeze or run, fight or flight. Exactly. And if there's a tiger coming at you, yeah, you're going to do sort of something similar, aren't you? You're going to freeze or you're going to run. So this is our what they call the HPA axis. The hypothalamus in the brain and the pituitary coordinate with the adrenals, which sit above the kidney, and they basically give you the energy to run or fight. So your body kicks out these hormones like cortisol and adrenaline. So your energy goes away from your gut because you don't really need to be digesting your food at that point. You need it in your leg muscles, you need it in your visual system. And your heart rate's going to go up, isn't it? Because you're ready to do action. That's good, that helps you and can actually save your life. But not when stress is ongoing and your body's pumping out these various chemicals like cortisol, for example. So we know that the endocannabinoid system is involved with this HPA axis. And how do we know? Because we know that anandamide and 2-AG and the CB receptors and the enzymes are all found in those regions. We also know that human cannabis consumption is associated with reduced anxiety and less stress and greater relaxation, don't we? And they've found when they do animal studies that if you disrupt that endocannabinoid signalling, the animals start to show symptoms of stress here. So they're hypervigilant, increased heart rate, and they're spitting out their equivalent of our chemicals, showing that they're under stress. So normally the endocannabinoid system actually regulates the stress response. But if we have chronic stress, then the endocannabinoid system gets down-regulated instead of up. It's down-regulated. So you get excessive stress responses and you get poor adaptation to stress. And this prolonged exposure to stress hormones like cortisol in your body can then cause illness like cardiovascular disease and cancer, as well as depression and other conditions. So the endocannabinoid system becomes dysregulated. This dysregulation is implicated in all those diseases I've listed there, which are mental health conditions, as well as many other ones that I won't be talking about today. It's also involved in memory, and it's found in the areas of the brain that are important for memory. So we know in PTSD that it's called a paradoxical disorder of memory because you remember a lot of the details of the traumatic event, but you forget some of the other aspects of it. The stress response is maladaptive in PTSD, so you've got hyperarousal, you've got nightmares, you've got and poor sleep, and you've got these intrusive memories always coming up. And these are facilitated because our endocannabinoid system signalling is not working so well. So you get a hyperfunction in one bit of that corticolimbic system and a hypoactivity of the prefrontal cortex, which normally controls the amygdala. but it's not controlling it in PTSD. So normally under adverse conditions, the endocannabinoid system wants to protect us because it is an intelligent system. So normally under stress we get increased signalling, and that dampens down the activity of anxiety, and it regulates the encoding of these traumatic memories, as well as our ability to basically extinguish them. But in PTSD, the endocannabinoid system is actually altered. Now, I guess some of the research is positive in a way, because it shows that, look, if you can activate the CB1 receptors in the amygdala, that can help decrease stress and anxiety. If you can activate it in the prefrontal cortex, that's going to do something. It's going to increase one of our happy hormones, serotonin. And if you activate it in the hippocampus, it can increase neurogenesis, that's new nerve development, mood and memory, and decrease some of the symptoms of PTSD. So scientists are always looking, and particularly drug companies, are always looking at ways that they might be able to facilitate that by, creating a drug that might do that. Now, another important thing is that the endocannabinoid system really governs our brain development from the fetus right through adulthood, and then, for the rest of our lives, really. The key point I want to make here is that in adolescence in particular, you've got a lot of new nerves and nerve connections being developed, and in adolescence in particular, these get pruned back a bit, so it actually refines your brain, if you like, in layman's terms. So the adolescent brain is particularly vulnerable, and so is the young child's brain too. So if you have stress in early life, that can actually end up altering the endocannabinoid system, and it can cause sustained problems, particularly in the areas like the hippocampus that are involved with regulating our stress and our emotions. So early life stress can be quite detrimental later on in life. Right, are you all experts on cannabis? Who's not an expert? A few of you aren't experts. All right, so we'll just run through some of the basics. The constituents. Cannabis is not one thing, and it's not just THC and CBD. It's over 750 chemicals. They're called secondary metabolites in cannabis. Now, the main ones that we hear about are called the phyto. Phyto means plant cannabinoids. Just like we said we had endo within the body, cannabinoids, these are plant cannabinoids, phytocannabinoids. And the reason took you through that learning about endocannabinoids is that if you understand we've already got a ready-made system that can actually benefit from these phytocannabinoids. But we've also got these essential oil-like substances. They're called terpenes or terpenoids, and we've got over 200 of those. They're not just found in cannabis, by the way, so they're found in pine leaves, so alpha-pinene, for example. Linalool is found in lavender. Myrcene is in mango and hops, those sorts of things. But those, like any form of herbal medicine, all those other constituents add to the therapeutic effect of those main phytocannabinoids that I'm going to talk about. And that's called the entourage effect. So it's like going to see a rock band. You've got someone up on stage singing, but you've got all the roadies out the back, and that rock band doesn't work without the roadies, right? So that's how I like to think of the entourage effect. Where are these phytocannabinoids and terpenes produced? Well, if we take a microscopic view of the female, unfertilised female flower, then you see these little glandular structures on it called trichomes, and these are little phytocannabinoid factories there. You also get them on the leaves and the stems, but not so much. So it's the unfertilised female plant that they're after. That's in comparison to hemp seed oil that you can buy in the supermarket and chuck all over your porridge. That is, there's no phytocannabinoids in that, so that's just a food. But it's a very good functional food, and it's got lots of therapeutic benefits as well. So hemp seed rocks, really. Now, if you grew up in the 70s like I did, you might have remembered an ad on television, Oils Ain't Oils, and I think it was from Castrol GTX. Everyone who remembers it? Right, you're all my age. Okay. Now, basically, oils ain't oils in cannabis too, because there's thousands of different strains or cultivars, they're called, of cannabis. And they've got some great names, and you'll know the names better than me, no doubt. But each has got its own profile of chemicals, the phytocannabinoids, the components of those, the ratio of these different terpenes, and these have different therapeutic effects on the body, as you'll know. So we've got 11 main classes of these phytocannabinoids, and mostly we hear about THC, tetrahydrocannabinol, and cannabidiol, and I'm going to just mostly talk about those today, but there's a whole lot of other ones there. There's more and more research happening on those now. Now, the gentleman before me was quite right. The plant actually contains the acid forms of cannabidiol and tetrahydrocannabinol. So tetrahydrocannabinolic acid, THCA. Now, that is not euphoric. It doesn't produce the euphoria that THC does, but it is on heat or light or aging that causes it to lose its CO2, carbon dioxide, and then it becomes decarboxylated. Then that is THC. Terpenes, as I said, more than 200 of them. They've got their own receptors that they bind with, and they've got their own therapeutic actions. So let's have a quick look at some of those key actions of the phytocannabinoids. I've put some of them in the slide up there. You can see anti-inflammatory pops up a lot. Antidepressive, antiemetic means to stop you throwing up, anticonvulsive for CBD, etc. So here's some of the ones I've listed in green I've just put because they're in particular involved when I'm talking about mental health conditions. But you can see anxiolytic, antidepressive, antipsychotic for CBD, anti-inflammatory, nerve protecting, antioxidant, immunomodulatory. These are all important when we think about the actions therapeutically. So THC mimics anandamide. It binds with CB1 receptors partly, so it's called a partial agonist, and that helps modulate some of the effects on the mind. It's a partial agonist at CB2 receptors, and therefore it can modulate some of the immune system actions and anti-inflammatory effects. The brain has got many, many connections. The endocannabinoid system is connected with many other neurotransmitters, so they think that THC could have widespread indirect effects by modulating the endocannabinoid system, which is also connected with all these other neurotransmitters as well. Cannabidiol works in a different way, so it doesn't like binding much with CB1 and CB2 receptors. It's got what they call low affinity. It works through other receptor targets, in other words, and some of those can be the serotonergic or serotonin. Remember we said serotonin is one of the happy hormones. That helps mediate its anxiolytic effect as well as antidepressant effects, neuroprotective effects, etc. And at CB2 receptors, CBD can help modulate inflammation and the immune system effects too. So importantly, it has nerve protecting effects. So it can stimulate synaptic plasticity. So that is the ability to form connections in the brain. It's also got neuroprotective effects. It can reduce the microglia activation and get them to return to their resting quiescent state. It can decrease these inflammatory chemicals called cytokines that get kicked out. It can change vascular system and reduce neuroinflammation that way. So lots of different ways. It elevates something called brain-derived neurotrophic factor. That is low in certain conditions of mental health, like in depression. And here are some of the terpenes which have anxiolytic actions. So beta-caryophyllene is also very good anti-inflammatory actions, limonene, alpha-pinene, myrcene, and many others. So now that you're experts in the endocannabinoid system and what cannabis is, let's just have a step back and say, well, how is evidence used in medicine? And I've seen it used, as I said, as a political weapon or tool. I've also used it to affect change. I've seen it used to affect change. So I gave a slide set, something similar to this, to a colleague in the US. She's a researcher in PTSD. Before she actually, she didn't have time to present her on, I said, look, I've got one, present mine instead. She showed it to one of the bureaucrats in one of the states of the US. In the US, each state has a list of conditions where if you've got one of those conditions, you're allowed to have medical cannabis. We don't have that list here in Australia, which is a good thing, but they do. And they didn't have anxiety on the list, but on the basis of the evidence that I'd put together in this slide show that, you know, she was going to present at a conference, they actually added anxiety to their list of approved things. So you can see how, and I didn't even know she was doing that. She said, by the way, when she got here to Australia, and told me what she'd done. So there we can sort of see how evidence in medicine can actually be used to affect some sort of positive change. But I've also seen it where it's been used. Oh, we don't have enough evidence for that. We've got various medical groups saying, oh, no, we don't recommend it for chronic pain because there's not enough evidence. And I'm thinking, well, have you read anything? So anyway, if we look at the types of research that are done in science, we've got cell studies, we've got animal studies. And animal studies, I'm not a fan of animal studies. I think they should be banned. But anyway, they give us information about mechanisms of action, safety, is it safe, and efficacy, does it work? We've got human studies that basically are done after animal studies, typically on safety and efficacy. Again, does it work? We've got studies in populations. We follow groups of people across time to see what happens. They're longitudinal studies. And then we've got this thing called randomised controlled trials. Now, who doesn't really understand what a randomised controlled trial is? Do you all understand what it is? Yes? No? Right, some brave person that said they didn't. Okay, so randomised control. This is the hierarchy of evidence medicine. So case studies, so a doctor seeing an individual patient and they got better, low form of evidence in their eyes. Randomised controlled trials, which suit the drug industry quite well because they're only looking at single molecules usually. They don't suit plant medicine very well because you individualise medicines in herbal medicine to the patients. It's very hard to say, I'm going to give everyone that dose. That dose mightn't work for you. It might work for you, but not you. But they position randomised controlled trials up the top. So basically you've got two groups. It can be more than that, but usually two groups. You've got very strict inclusion criteria. So if you've got these conditions and these factors, you can come into the study. If you've got those, you might be a bit different. No, you're out. One gets the intervention, that could be medicinal cannabis, and the other one gets a placebo or another drug, a comparison. That's called the control. And they basically say at the start of the study, we want to measure change in this outcome variable. It might be anxiety. At the end of the treatment period, that could be 2 weeks, could be 3 months, they say, well, is there any difference in how each of the groups change? And they analyse that statistically. But, as I said, it has particular problems when you're looking at medicines which are individualised to the patient. Now, I did my PhD on this in 2003 in Chinese medicine, Chinese herbal medicine. It's a similar sort of concept, except Chinese medicines tend to have about 10 to 15 different herbs in a medicinal formula, not just one. But it's the same concept here. You're individualising the medicine to the patient. It's very hard to whack that into a randomised controlled trial model and then pop something out at the end. So, with that in mind, let's just trip through some of the evidence in the literature about anxiety. I'll just use that as an example. So, we've got different types of anxiety. Most of the studies have looked more at social anxiety disorder and generalised anxiety disorder. If we understand the pathomechanisms of what's happening, then we can start to understand how the constituents of medicinal cannabis might work. So, in anxiety, we've got a dysregulation of, remember we talked about that prefrontal cortex and the amygdala. Normally it checks the activity of the other one. There's a dysregulation there, so it's not doing that checking. There's also problems in impaired neuroplasticity, so that ability to form connections is impaired. Stress can impair neurogenesis, the formation of new nerves, and the neurogenic theory of depression says that impaired nerve generation in the hippocampus triggers depression. If you restore that function, then you get recovery from depression. They also think that could be one of the mechanisms underpinning anxiety as well. Inflammation is present in anxiety. It's also present in a lot of other conditions too. So you've got a dysregulation of the immune system, and that's linked to anxiety and depression and problems with your sleep. And you know, if you don't sleep well, everything else starts to sort of go downhill after that too. Systemic just means in the whole body. Inflammation. when you have systemic inflammation, you usually get disturbances in the regulation of your emotions, and this underpins conditions like anxiety and depression. So they've actually measured people with different things like anxiety disorder or PTSD and found that they've got high levels of these inflammatory markers or chemicals in the body. So the endocannabinoid system in anxiety, we already know that it's widely distributed in those areas that help control our emotions. We already know that. We know that it regulates the stress system, our HPA axis. So they've found that when you get chronically induced stress productions of these things like cortisol, they downregulate the signalling of our endocannabinoid system. And so you get the loss of that negative feedback system that should normally keep our cortisol levels at a reasonably good level. This gets lost. We also find that there's less neuroplasticity in the brain when people are anxious or depressed as well. So research tells us something's going on here. So now that we understand a bit about what's underpinning at a cell level and a tissue level, we can now look at cannabis and say, well, how can it help? Now, they think that CBD, cannabidiol, and you'll know that this is not something that causes euphoria. You can't say it's not psychoactive, because if it has an effect on the emotions, then technically it's psychoactive, isn't it? So I usually say it's not intoxicating. It affects the serotonergic system, and it helps reduce anxiety that way. It also can help increase the nerve production, neurogenesis in the hippocampus. Remember, we just found out that this is impaired in some mental health problems. Well, this can actually help with that impairment. It increases adult hippocampal neurogenesis. It also can prevent the breakdown of anandamide, and they've found that when you get increased levels of anandamide in cerebrospinal fluid, that's inversely correlated to psychotic symptoms, so it's the opposite. So you want it high and then you'll have low psychotic symptoms. CBD as well as THC also are able to affect the immune system, and that's concentration dependent. So they've done studies in animals, and this one's called the forced swim test, and it's disgusting really. But it basically, they put a mouse in, a beaker of water there, and it has to just swim. And if it gives up, well, then you know that it's depressed. That's their measurement of depression. And they'll say, all right, well, if we give it CBD, does that change that? So they've actually found that chronic administration of pure CBD has a moderate anxiolytic effect at mice at low and high doses. They did another study where they dosed the rats for either acutely, so that means they tested them straight away afterwards, or chronically, they treated them for 14 days with CBD, and then they assessed their behaviour. So the forced swim test, they did that one, and they found in that case that CBD was able to reduce this depression-like behaviour, as well as increase a particular chemical in the brain which was relevant to depression, but it didn't actually have much effect on anxiety. So again, you sometimes get differences in what happens in rat and animal studies, same in humans too. This one's called the elevated plus maze. So you can see the little mouse out in the end there, and to be out in the open on thing that's high up is anxiety producing for an animal. So they basically injected the mice with CBD with various doses and THC, and then CBD plus THC, or diazepam, which is a drug, and then they tested them on this elevated maze. And they found that CBD didn't seem to have much effect in terms of an anxiolytic action, but they found that THC significantly increased the time that they spent out on that open arm platform, and that indicates less anxiety. So that was their measure that, hey, maybe THC is working here as an anxiolytic. Interestingly enough, when they combined THC and CBD, no different to THC on its own. So looking at what happens in our brains, they've done images of our brains. Public speaking is generally a fairly stressful thing to most people, not used to it. It's even stressful when you are used to it. And what they did is to say, well, we want to look at the brain, the blood flow through your brain when we subject you to a public speaking test. Now, they basically dosed one group with CBD, that was 400 milligram, and the other with a placebo. Now, in these studies, the person doesn't know what they're getting. So that's called blinded. And the person who's measuring it doesn't know who got what, then it's double-blinded. They found that 400 milligram of CBD reduced subjective anxiety and made changes in a particular part of the brain. And they also found that the subjective rating of anxiety was reduced with CBD as well. Then they said, well, that's all very well. That was in healthy patients. Let's have a look at a group with social anxiety disorder. And they did the same test, basically. Now, they found that the single dose of CBD reduced the subjective feelings of anxiety as rated by the participants. Both before, so that's anticipatory anxiety, so you get nervous because you anticipate getting up in front of people, as well as after. And they found that in this case, there was decreased activity in that particular part of brain. So they think, well, look, maybe something's different happening in the brain in people with social anxiety disorder compared to normal healthy people. And that wouldn't be surprising, really. They did another study here. This was a double-blind thing. Again, public speaking test. Same thing. Pre-treatment of CBD helped reduce significantly. And when I say significantly, that means statistically speaking. So it wasn't just by chance, in other words. The placebo group had high levels of anxiety, cognitive impairment, so your thinking's not as clear, and their alert levels much higher because, they're nervous, they're stressed. So CBD appeared to work there as well. Now, when they've used it as an adjunct, so these people are in a psychiatric clinic this time, and they said, look, keep taking your normal drugs, but let's see what happens if we give you this as well. Some of the patients there had sleep problems. Others had anxiety. So if they had anxiety, they were given the CBD in the morning, and if sleep problems were the problem, then they got the dose in the evening. So they looked, and it was, a reasonable, it wasn't a big dose, 25 milligram a day. They found that anxiety scores decreased within the first month of treatment in 57%. So 57 patients, that's nearly 80% of the patients. Sleep scores improved within the first month, but then they sort of fluctuated over time. So CBD appeared as an adjunct, and it was well tolerated in all but 3 patients. This study was a randomised controlled trial in Japan. These are teenagers this time, double-blind, randomised. They either got 300 milligram of CBD or the placebo. They looked at their social anxiety symptoms at the start and the finish after 4 weeks, and they found CBD significantly reduced the anxiety, comparable to a drug that's often used to treat it, paroxetine. This one was done on flower. This was an app. So people were smoking it, and they found that there was a decrease in symptom intensity in 95% of the cannabis usage sessions. On average, a significant reduction in stress and anxiety, statistically speaking. So there was another study, this time looking at low and high doses of CBD in healthy cannabis users. So they did them over 4 different sessions. They did find in this one, though, that the ratings of anxiety increased after smoking cannabis compared to placebo. And they also found that it affected their working memory and episodic memory as well compared to placebo. So you don't always get, positive results. You start to say, well, hang on a minute, could there be a problem there as well? The last one we'll talk about, this one was low dose of THC. They found that decreased the emotional sort of stress signs, but higher doses, like 12.5 milligrams, started to increase anxiety and depression and distress. But overall, a systematic review, when they pull all those randomised controlled trials together and they basically say, what does it tell us overall? They found that pharmaceutical, THC with or without CBD, actually improved anxiety symptoms among people with other medical conditions. So the last thing I want to talk about is really the safety issues. Is there an association between cannabis use and anxiety? Now, association, as the gentleman said before me, doesn't mean causation. And this is where it gets muddled up in people's minds, and they immediately say, oh, it causes it. Well, no, it's an association. We don't know which way it goes. One of the studies said, again, a systematic review, pulling all this data, said, look, there is a positive association between anxiety and cannabis use, or anxiety and cannabis use disorder, but we don't know whether that's causative or not. You can't say that. There was another study that said, well, look, we want to know whether the prevalence of mental disorders is different between frequent cannabis users and with and without dependence as compared to the general population. Now, they found both dependent and non-dependent cannabis users, frequent users, were at higher risk than the general population for any disorder, and the risk was greater for cannabis dependent than non-dependent frequent users. But when they factored in other things like their childhood adversity or substance use other than cannabis, a lot of these associations then became non-statistically significant. In other words, other things explained the anxiety and not that. They've also looked at, is there an association with cannabis use in adolescence and later depression or anxiety? Again, a systematic review of different studies, and they looked at kids below 18 years. They ended up with 11 studies, so that's over 20,000 individual data points, if you like, people in it. They concluded that there were significantly increased odds of developing depression in young adulthood, in cannabis users in adolescence compared to non-users, increased odds for suicide ideation and suicide attempt, but no significant increased odds for anxiety. And another study that was done over 30 years also found the same sort of thing. Cannabis use during adolescence was associated, not causing, but associated with depression and suicidality in adult life, but not anxiety disorders. So I think for the take-home message for me, being a mother of a teenage son who's now 18, is I don't think cannabis use is great in adolescence. That's my take-home. So, I guess in wrapping all that up, what I wanted to try and sort of talk you through is to understand a little bit about how evidence is used in medicine. You can see, I think, from that talk that there seems to be a fair bit of evidence. That's only 1/10 of what I could have given you. I've actually just written a book on mental health and cannabis that will be published in the US in a couple of months. So I've spent 18 months virtually ahead in the research. And at Releaf Group, I'll be actually doing our own clinical research soon as well. Randomised controlled trials and systematic reviews are actually fundamentally flawed, and yet they're used as the top evidence in medicine, and they're used as a political weapon, often by groups in medicine, to stop something. So, as I said, there are other types of studies that I think we need to be looking at. We need to be looking at case studies. That's how doctors learn, after all, and that's how we actually start to learn that something might work. It's certainly how herbal medicine developed. So I think the insistence on randomised controlled evidence to justify the use of cannabis and access to cannabis, is it overcautious? Is it a medical dominance issue? We've had that before in acupuncture in Chinese medicine. Is it a fundamental lack of understanding about plant medicines? What is it? Not sure. Probably a bit of everything. So what I wanted to do with the last couple of minutes is to talk about something else, which is really, and I actually want to involve you because I'm sick of talking now. So I actually want you guys to give me some feedback. It's about, I've talked about what's happening at the cell level and the tissue level and the brain level and all that's all very interesting. What's it doing on a spiritual level? We're not just cells stuck together, are we? And we're not just our emotions. I've only talked about anxiety. We're a mixture of everything. What doesn't get much airtime is the spiritual aspect, and I'm not talking necessarily about the use in the Rastafarian community. I actually went to Montego Bay a couple of years ago and met a few of the Rastas, and I was really interested. I actually didn't end up going to one of their ceremonies because I ran out of time. Would have loved to. But I'm interested, particularly with end of life. We're all going to face that at some point. Those of us with ageing parents are facing it with their ageing parents. What's happening at the end of life? People are dying of conditions, and these conditions can be strung out. So we know that, yes, it can help with perhaps anxiety and maybe depression associated, but what about spiritual epiphanies or developments? I read a couple of papers about that, and it really made me sort of think, we are still puddling down here talking about the nuts and bolts thing, but what is it capable of? So you guys are probably going to be a lot more experienced about this than me. I'm interested if some of you want to share your thoughts about this. So who's going to be brave? I can see you now. Put up your hand.
I'm coming with microphone, please. Well,
Hi, how are you?
Good.
Thanks very much for speaking, and a very relevant point. Oh, sorry, how's that better?
Right.
Thank you very much. I've got a couple of questions.
Yep.
The presentation has been great
Yep.
as far as the how these act on at a molecular level,
Yep.
right?
Yep.
I understand that there's a heap more more research
Yep.
to be done, but getting to the point that you've just touched on there,
Yep.
as far as cannabis and for other plant medicines, psychedelics, etc. You talk about the entourage effect,
Yep.
and now you're talking about spirituality.
Yep.
These medicines, how are they being categorised? How are they being documented?
Yep.
How are they being regulated? And who is doing it? Because are these new medicines going to be treated in a different way, or are we staring down the barrel of another DSM-V5? Are
Yeah.
they already slotting in there? Because
I think in research what they do is that they'll actually go at those DSM-5, these diagnostic definitions, what anxiety is or PTSD is, because they want to say, well, look, you're definitely in this, and this is the limitation of research, right, that I'm trying to sort of allude to, is that you've got these categorisations, putting people in a box. So you've got these, so then you fit into that box of anxiety, social anxiety disorder, or PTSD. And if you've got that, well, maybe you don't fit in there, so I'm not going to put you in my study, and therefore I'm not going to necessarily get the data on you. This is one of the limitations of randomised controlled trials, is that they're very much not real life, in that they're trying to, that's what I mean by narrow inclusion criteria, and yes, they do. The other thing that I see that you're alluding to, I think, is that I've talked a little about THC and CBD separately, and in animal studies, they nearly always use just pure CBD isolate. Now, I'm not a big fan of isolates at all. And I think some of the better research that's coming through in human studies is on whole plant medicines. That's where I think we'll need to go. But you can't say, if you think that different cultivars are going to affect the body differently, you can't say that the research on that cultivar is immediately applicable to that cultivar, because it's got a different chemical profile. So that's where it starts to get difficult. And the problem with plant medicines is that there's often not a lot of money around to do the research. So we know why the pharmaceutical industry dominates medicine, don't we? It's money. So they spend millions, billions of dollars on a molecule that they can patent and then sell, and then no one else can sell that one because they've got the patent on it. It's hard to patent a plant medicine. So I'm not sure that I totally answered everything that you were getting at, but I thought you got some really good points there.
sorry, can you stop talking because we're recording this and we can't hear you?
Yeah, I'm sorry about that. Just with the spirituality element of that, is there any way to kind of categorise that? And is that something that is being looked at in plant medicine?
I don't think there's a lot of research in it. There was a fellow called Sunil Agarwal who I actually reached out to just sort of try and have a chat on this issue, because he works in palliative care and actually was looking at how that sort of eased people. And he alluded to the spiritual aspects, or spiritual almost development, if you like. The best type of research is not a randomised controlled trial for that sort of thing. It's what they call qualitative research, which generally means sitting and chatting with people, and you'll chat with other people, and then you start to see themes pop out of what they're saying, and that's what you're looking for in qualitative research. And the answer is no, I don't think there's being much done about it, but I think it would be a really fascinating thing to look at. I also think it's a fascinating thing, an important thing for doctors to be actually looking at in relation to their patients. So it's not just about stopping the pain, but, you know, if you talk to people and start to understand that they're going through the most fundamental, profound thing we'll ever go through, apart from birth, I suppose. Yes.
Okay. Kylie, thanks for a very comprehensive talk. There's just one tiny point of disagreement.
Yep.
I mean, I understand your anxiety as a mother of an adolescent male,
yes,
and the use of cannabis.
Yep.
But in my personal experience, cannabis use has realigned my trajectory in my life.
Yep.
and I wouldn't be the person I am without the adolescent use of cannabis. So
Sure.
it's
Yep.
horses for courses, but that's not the point I wanted
Yep.
to make.
Yep.
You've mentioned twice the very important issue of the down-regulation
Yep.
of the endocannabinoid system under chronic stress.
Yep.
I just want people to be alert to the fact that the endocannabinoids, as you mentioned, the anandamide, are made out of the cell membrane on demand. That's part of the mystery of the endocannabinoid system. But if you haven't been in the long term ingesting enough omega-3 and your omega-3 6
Correct.
balance is wrong,
Yep.
you simply don't make enough anandamide.
That's right.
So in the long term,
Yep.
it's a depletion under chronic stress. Too much
Yes.
anandamide is made, degraded.
Yep.
So basically the take-home message is eat your hemp seed.
Yes, and you're absolutely right. I've done a whole presentation on diet as well, but I think you probably had enough of me today. But you're right. It is our balance of omega-3 and omega-6s. So in the Western diet, it's what they call pro-inflammatory. Normally humans were developed with sort of around sort of 2-to-1 ratio, but we've got actually a 30-to-1 ratio or 20-to-1 ratio, depending on who measures it, of omega-6s, which are basically more pro-inflammatory compared to the anti-inflammatory omega-3s. Now, hemp seed oil's got the almost perfect balance of these omega-3s and omega-6s. So it is right that we actually need our omega-3s in particular, because usually we've got too many omega-6s, so it's about the balance between those. You still need some omega-6s in your body to do good things as well, but basically the Western diet's well out of whack, and so hemp seed oil is probably the most perfect balance. So you're absolutely right, and thanks for bringing that point up. It was excellent.
Kylie, we have one more question before we hand over to the next speaker, which is Dr. John Tay. And if there's anyone else that really wants to continue some conversations or have questions for Kylie after, then please approach her privately after. So one more question.
Hi. Hello.
Trying to see you here.
Sorry, I'm just here.
Right up the back.
Oh, right, okay, yep.
She's coming down.
Got you.
Just here. There's always such a focus on the brain for mental health treatment, and cannabis and CBD oil, should heal the brain. I've come across some research recently in regards to polyvagal theory, which is actually the treatment of the nervous system.
Yep.
And my question would be, has there been any research that would connect the healing of the nervous system with any CBDs? Do you know anything about that?
About that particular theory in the vagus nerve, or?
No, the polyvagal theory?
Yeah, yep. Not that I've read much on, I'll have to be honest there.
No, it's just because apparently to heal any mental problems is actually a matter of healing trauma.
Yes.
And to do that, we do it through the nervous system.
Yep, that's right. So you can see how it could possibly work then, because remember, we've got those CB1 and CB2 receptors all over the body, not just in the brain. So even though I focus on the brain, they're actually in lots of different systems. If you want to chuck Chinese medicine in there, then each of our organ systems is related to an emotion anyway. So when you're treating emotions in Chinese medicine, you're not focusing up here, you're focusing all over the body.
So has there been much research? Is there a body of work that can be looked into about CBD or THC in regard to polyvagal theory?
I'm not aware of the research, that's my honest answer on that. So, but I can, certainly have a look at it. Now you've told me something I have no idea about, I'm going to look it up.
That's what I wanted to do, yeah.
Good on you.
Great, thank you very much, Kylie. That's been extremely enlightening, and thank you once again for travelling from Victoria to be here with us at MardiGrass.
My pleasure.